All right, good evening. Welcome, and thank you so much for joining our Novant Health UVA Health System Black and African American Community Town Hall, where we will be discussing tonight the facts about the COVID-19 vaccine. My name is Dr. Karen O'Brien, and I'm a leader at Novant Health UVA Health System, and one of my roles is to support our continuing work on diversity and inclusion. The COVID-19 pandemic has not affected everyone equally. And we at Novant Health UVA have seen and experienced firsthand that people of color have been significantly impacted by this virus in larger proportions than Caucasian and white communities. Health equity did not start with the COVID-19 pandemic, and it is not a new experience for our communities of color or several other communities. With the breakthrough of the COVID-19 vaccine late last year, we would be remiss if we didn't acknowledge and start this conversation with the importance of understanding the historical trauma that Black and African American individuals, families, and whole communities have experienced and endured that was directly connected to the medical field and or government. Our conversation tonight about the facts of the vaccine is intentional. We want to ensure that we, Novant Health UVA, are directly connecting and engaging with our community, specifically our communities of color, to ensure that you have the factual information about the vaccine in order to make an informed decision that is right for you. As the health system in your community, it's important to us that we are building bridges of trust and seen as a trusted source of healthcare information and medical information. So again, thank you for joining us tonight for this important conversation. We're excited that you're here. So before we begin, I'd like to introduce our esteemed panel members and guests. And I'm going to start with our fabulous partner, Reverend Cozy Bailey, who wears multiple hats in support of our community, and one of them being the president of the Prince William branch of the NAACP. We have Dr. Zan Zaidi, who is a physician executive, and he has been working in step with the Virginia Department of Health and our CDC and providing direct patient care on our medical floors for our COVID patients. We have Dr. John D'Souza, who is the Chief Medical Officer for Culpeper Medical Center. You see him waving there. And he as well has been in lockstep with the CDC and the RAP Health Department. Dr. Anastasia Williams is our Medical Director for Pediatrics, and we will be hearing from her and her own personal experience. Michelle Strider is our Chief Quality and Safety Officer for Novant Health UVA and has been doing an incredible job since the beginning of this pandemic to ensure that our community and our team members are safe. And we have Dr. Stephen Smith, who is our President and COO for Prince William Medical Center and Haymarket Medical Center. And in between that, he also serves as a physician in our emergency room. So we'd like to make this a conversation as much as possible in this virtual Zoom world. So please, we would like to invite you to feel free to put any questions that you may have pertaining to the vaccine in the chat box, and whether it be throughout the town hall. And we will have some time towards the end to be able to go through questions and have our expert panel answer. And we do have those questions that were also sent in earlier before our webinar today. So to kick off our conversation, I'd like to invite Reverend Bailey to be able to share some thoughts and perspective with us. Thank you.
Thank you, Karen. And doing the required Zoom thing, hope everyone can hear me. Good, it's good to know I'm not talking to myself. Thank you very much. I'd like to add my welcome to everyone this evening. This will be a very informative evening and something I think that's required in our community for a variety of reasons. First of all, one of the things that you'll hear this evening is factual information that hopefully will dispel some of the rumors that may be running rampant in order for everyone to be able to make the right decision regarding COVID-19 vaccines. The group of people assembled here tonight are reliable sources of information. Why do I say that? Because I know them personally. I have worked with Novant over the past year. They were great partners in a drive that we had early in 2020 to provide free testing, emphasis on free and reliable testing for COVID-19, because they understand what it means when we talk about health inequity. Let me stop right there for a moment. I was trying to find a definition that everyone could understand about what health equity means. We throw those terms around all the time. And here's what I landed on. Health equity is the absence of unfair and avoidable or remediable differences in health among population groups defined socially, economically, demographically, or geographically. Said in simpler terms, health equity is about providing the health needs to people where they sit. It's very different from equality. Equality means to give everybody the same thing. But the communities that the NAACP is focused on, communities of color, and as Karen already said, specifically Black and African American, have very unique needs. Novant understands that. And so Novant is focused on providing health equity to these communities. I am so glad to be a partner with this effort tonight, and I am sure that everyone will be better educated as we go forward. So thank you all and welcome.
Thanks, Reverend Bailey. Well, now we're going to turn it over to Dr. Zan Zaidi, who's going to share some information and foundation around the vaccine. So we can get those slides. Thank you.
Thank you, Karen and Reverend Bailey. It really is an honor to have the opportunity to speak with you all tonight. If you'll please advance to the next slide. It's been almost 1 year since the first COVID case in Virginia. It was early in March. I think for many of us in healthcare, we all remember where we were that day, and this sort of sense of dread for what was coming. And I don't think anybody could have imagined at that time just what our community, what the world would look like a year later. What I think is helpful sometimes is to look at a timeline of what has happened in that year. And I think as all of us have felt very closely, we are just coming out of a very dark period in the evolution of what has happened. Over the last, starting in November, started a 3+ month period where both at a community and a state and national level, we've had record numbers of cases, hospitalizations, and deaths. As we all recall, in March, April, May, there was an initial surge that really affected the northern part of Virginia and a bit of the central part of Virginia. It then spread later in the summer months to communities in the south of Virginia towards the beach, and settled down then for a few months until what we've really experienced through this fall surge all the way through the holidays, which was really unprecedented. Now, there's great reason for optimism now, and I think that's why it's really an exciting time to be able to have this conversation, which is that we've had all of those indicators, cases, hospitalizations, deaths, have been down for consecutive weeks and are coming down very, very quickly. In fact, they're coming down so quickly that I really do, and my team foresees a period of probably at least a couple of months now where we're really hopeful that as a community, as a nation, we can get vaccination figured out, and that really anybody that's eligible to vaccinate and who is comfortable to vaccinate has an opportunity to vaccinate. Next slide, please. One year into this, I think it's clear to all of us that COVID-19 is much more contagious than the flu. It's more deadly than the flu. And sadly, it's killing members of our communities disproportionately. Reverend Bailey referenced health equity. Karen spoke to this really nicely, but this is just unfortunately the most recent reminder of both structural racism and so many other factors that drive health disparities in the United States. It's been a part of our history, and it's something that I'm hopeful that COVID-19 and really the progress in the next several months that we have an opportunity to do better. I think science and kind of the events in 2020 have given us an opportunity to really reach our communities in a more meaningful way, and really for healthcare systems to help drive that change and to prove that we can do better than what our history shows. The numbers here really speak to themselves. That whether you're talking about the number of members in the community of Black or African American descent versus others dying at a higher rate than any other group. The graph on the right is similar data shown differently, where it's age adjusted and shows a similar story where this part of our community is 13% of the population, but is responsible for 19% of the deaths. Next slide, please. One question that my team and I get asked often is how were vaccines created so quickly in 2020, and really is it safe to trust this vaccine? And these are really fair questions. This is a very loud slide. I promise I won't get into all of this, but what I've got here on the top half is the timeline for how vaccines have historically been developed. And on the bottom, you'll have a timeline for how the COVID vaccines were developed and how they were developed so much more quickly. And I'll boil it down to a few simple phases. Before a human can even be involved in any of this work, they have preclinical trials. And that's that part on the left side in both of these where you see mice. And so this is where work gets done with cell lines and labs. This is where you work with animals to determine some basic safety parameters. And so much of this work had already been done 20 years ago with SARS, and then again about 8 or 9 years ago with MERS, two big viral outbreaks of a very similar virus family, a different type of coronavirus, but one that allowed for a lot of that work to get done. And so in a lot of ways, scientists were not starting from scratch in 2020. When you fast forward to the middle section of these two timelines, what you'll see is that typically you have one phase of a trial that's followed by the second, that's then followed by a third. And what was accomplished last year is that a lot of this work was overlapped, and so as soon as there was basic data to suggest that it was safe to start testing this, they started doing things in parallel rather than waiting. And some of this was made possible because there was governmental support, not just from the U.S. government, but from the UK and many others to various of these manufacturers. But some of these companies didn't take any money to do this. And so when you combine these two things together, that shaved a lot of years off of what typically would take a lot longer. One thing that's also, I think, obvious to any of us is that this was a pandemic. And so the rate at which we had positive cases in the community was really just, it was unbelievable, for lack of a better word. And what that allows you to do is when you create these trials, the trials can't end until a certain number of people get sick. And then once a certain number of people get sick, you look at the half of the group that did not get vaccinated and then the other half that did, and then you compare the differences in the infection rates. And so it was a really key factor in how these trials were able to end and get into the review phase so much quickly than before. At the end of all of this is a very a process of data review that lasts for almost a couple months before the two vaccines that are in the United States were able to get the level of approval that they have right now. So these are independent. These are not government agencies, but just specialists in infectious disease and epidemiology and so many other disciplines that come together and just say, is this safe to take and give to large members of the population? And so it was really really nothing short of miraculous that we're in a position now to have not one, not two, but 6 vaccines that are being given around the world already. Next slide, please. Very basically, I'm just going to speak about how vaccines work, and I'm going to generalize to the 2 vaccines that are under FDA emergency use approval right now. One's made by Pfizer, the other is made by Moderna. Both of these use something called mRNA technology as the vehicle for how their vaccine works. And now this isn't new technology. It's just the first time that there's been approval of this technology to use in large segments of society. It has previously been used in trials for Zika and Ebola and many other conditions in the past. And so very basically, I think we've all seen this picture that's at the bottom right corner of the slide. That's a coronavirus molecule under a microscope. You see those little red spikes everywhere. And those spikes are the means by which, when the virus gets into your body, that it attaches to your cell and then starts to do bad things. It is what these vaccine makers have done is basically use this mRNA, which is genetic material. It is not an infection. It cannot infect you, but you can think of it as a blueprint for your body to make protein. This is what our bodies do 24/7 all the time. And so what is done is when you get a shot, this genetic material goes into your own cells. It only lasts for a few days. It just cannot live longer than that, the mRNA itself. But during that time frame, it allows your cells to make this protein. And the protein that it's making is that spike. And so your body starts to make these spike molecules that then go to the outside of the cell, and then it triggers your immune system to take over. The immune system responds in a number of different ways. But put simply, they attack that spike and they learn every little crevice, orifice. They break it down, they start to destroy it. And really it is their job to memorize every kind of nook and cranny of what that is, so that if later in life you come into contact with coronavirus, that your immune system can be ready. Where things ended up with these, just again, I'm speaking to these two trials because these are the two that are published. You have the Pfizer and the Moderna vaccine that both showed 95% efficacy. What that means is that 95% of those vaccinated never developed a single symptom, never got sick. The other 5%, we'll call those sort of the failures, may have gotten a cold or got a symptom of COVID, but never got sick enough to be in the hospital, and certainly didn't die. And that is just, it's an incredible number. You know, most of us in the medical community, we do backflips when a flu vaccine comes out and has 60% efficacy in a year. And yet now we had two vaccines developed in different parts of the world by different types of companies. One had government support, one really didn't. And they both used similar science to get up to the exact same outcome. It was, for me, it was really reassuring. And I think it sends a strong message. When you look at the most important part, which I haven't mentioned yet, is they looked at this data across the subgroups. That is to say, they looked by race, they looked by ethnicity, to make sure that, hey, is this only 95% because it works 100% in one group and then less so in the others? And what they found is that 95% was across the board. And so I think that is that's really important and relevant to our conversation tonight. Next slide, please. There's a lot of numbers on this slide, but I just spoke to this a little bit. This is data taken from those two trials, and what you'll see here are just raw numbers of the participants divided up by race or ethnicity. And so, put simply, there were about 3,500 members in one of the trial and about 3,000 in the other trial that identified as Black or African American. That accounted for just under 10% in one of the studies and 10% in the other. I think we would all love for that number to be higher and for that percent to mirror what it is in based on Census Bureau numbers. But I will say that from a diversity standpoint, this is much better than really what history has shown. I think we've had those same barriers that exist in allowing for access to these to this segment of our community applies to trials as well. To be able to enroll in a trial, you have to trust the trial. You have to have access to transportation. You have to have access to the types of institutions where trials get run. And so, to some extent, it's a little bit of a chicken or egg situation, but I think it's really meaningful that just in these two trials alone that that over 6,000 were enrolled, and really now the number is so much higher now that we've actually started vaccinating in the communities, and we've proven this to be safe. Next slide. Thank you. This is my last slide. I wanted to just speak a little bit to variants. This is something that has gotten a lot of attention in the media, and is really worth talking about as relates to vaccination. This coronavirus COVID-19 that causes COVID-19 is an RNA virus. RNA viruses are constantly mutating. Interestingly, this virus does not mutate nearly as much as influenza or most of the other respiratory viruses that we're familiar with. But there are so many cases around the world that mutations are taking hold, that are sticking. And so what a variant is, and particularly these ones that we're talking about in the media, whether we're talking about the UK variant or South Africa or Brazil, just to name sort of three of the big ones, this is how they classify a certain strain of COVID that develops when a certain group of mutations occurs occurs in a community, to where that strain then sort of outgrows the strain that had already been in the community. And so, where we sit today, it's becoming more and more clear that a couple of these are probably more contagious than what had been circulating over the summer and the fall, but not that they're more deadly. And I think that's a really important point, because the two vaccines that I've just spoken about with some detail, as well as the others in other parts of the world, you'll see a lot in the media about how they may have less efficacy, or they may have a higher failure rate. One thing that's held true across all of these is that nobody that's been vaccinated has ended up in the hospital or died in any of these trials. And so, when we start thinking about a vaccine failing, try to understand that what really that's telling you is that, that may be a person who had cold-like symptoms instead of getting really sick and being in the hospital. And so I think that's really important to point out, and really an interesting time of where we stand in early 2021, where we have cases now dropping. We have an opportunity to scale vaccination up and get it to those who are comfortable receiving it. And we have this perfect window, I think, to try to get another 100 million or so Americans vaccinated in the next 2 or 3 months. That concludes what I had to say here. I'm going to turn it back over to Karin.
Thanks, Dr. Thady. Quick question may be great to answer here. We're hearing the term RNA, but one of our questions does ask that we were given us, does the COVID vaccine change a person's DNA? Could you answer that while we're talking about this subject?
I'd be happy to. That's a really good question. It cannot. It's a completely different structure, and so again, you can just think of it as a blueprint. It doesn't interfere with your DNA. It just uses the machinery that's in your body to make proteins. Our body is designed to do this for all the things that sort of keep us alive and breathing and thinking, and really has nothing to do with DNA and can't change any of your characteristics. But really good question.
Great, thank you. So now we'd like to transition to Dr. John D'Souza, who's going to provide us a little bit more education and information about the vaccine and some potential symptoms.
Thank you, Karin. And I want to thank everyone for being here tonight and taking the time to become educated on this. When I found out I'd be eligible for a vaccine, I had questions, just as I'm sure you do. And so I'm going to share with you what I, as a physician, wanted to know and some of what I found out. Because I think some of those same questions I had before I decided to get the vaccine are some of what you're sitting here tonight trying to understand. So first off, I want to make sure that we understand what we're talking about, because if you open a newspaper, you'll see, a variety of vaccine candidates and what might be coming down the pipeline and that sort of thing. But right now, today, the Pfizer and Moderna vaccines, the ones that Dr. Thady was talking about, are the only ones that are currently available for administration. We're very fortunate because they're very good, and I'm going to talk about that in a minute. But those are the only two vaccines available. So the first question, that came to me is, what's the difference between those vaccines and which one should I get? It turns out they're both mRNA vaccines. They both work exactly the way that Dr. Zaidi described. The only functional difference between them is the days that you have to wait to get your second dose. So you have to get 2 doses for both of these vaccines. If you just get one, you'll get some protection, but you really need the second to lock in maximum protection. And so for the Pfizer vaccine, you wait 21 days and get your second dose. And for the Moderna vaccine, you wait 28 days and get your second dose. For all intents and purposes, they're equivalent for everything else. So which one should you get? Whichever one you can get first. So let's talk about safety and effectiveness, because I wanted to know, is this something that I should get? Is it something I should recommend for my family members, some of whom are vulnerable, have major medical conditions and things like that? And is this something that I can recommend to them? So in terms of safety, first off, I was comparing those vaccines. There's no meaningful difference between Pfizer or Moderna in terms of safety or effectiveness. Reactions are incredibly rare, and they're no higher than any other viral vaccine. And for example, the flu shot is a viral vaccine. In terms of efficacy, and I think Dr. Zaidi alluded to it, these vaccines have been more than we ever could have hoped for. They have an efficacy of 95%, and it goes past that, because if you're vaccinated, but you're in that very small group that somehow still gets COVID, the vaccine's highly protective against severe disease. So the most important statistic that I like to cite about safety and efficacy is that with regard to safety, there is not a single death anywhere in the world for these 2 vaccines that can be attributed to getting the vaccine. So in terms of efficacy, there has not been a single death from the COVID infection, from actually getting infected with COVID in somebody who's gotten the full series, which is both shots. Compare that to almost 500,000, almost 500,000 deaths in America alone from COVID in unvaccinated people. And by the way, almost 60,000 of those were Black or African American. So 500,000 in America, 60,000 Black or African American. How many vaccinated people have died from COVID? 0. And so I think that really laid in for me in stark contrast the value of this vaccine and the safety of this vaccine. There are side effects to be had with any treatment, particularly any effective treatment. And I want to make sure that we differentiate when you read about reactions in the media, people having anaphylaxis or allergic reactions, that's not what we're talking about. Those are incredibly rare. Side effects are different. And if you've ever had a flu shot and felt some body aches the next day, or felt a little feverish the next day, if you've had a tetanus shot and your arm has been sore the next day, that's what we're talking about with side effects. And those are not a reaction, and those are not dangerous to you. That comes from your body's natural reaction to the vaccine. And it's basically your immune system doing what it's supposed to do to ramp up and fight off what it perceives to be an infection. And when it does that, it's basically preparing to fight the real infection should it ever enter your body. And so the most common thing, again, if you've ever had a tetanus shot, if you've had a flu shot, injection site pain, which is basically just a sore arm. The side effects from the second vaccine are usually more than the first, because your body is primed from the first vaccine, and it's actually ready to fight what gets injected on the second vaccine. That's how you know it's working. But particularly on the second vaccine, we do see people who having fatigue and muscle pain and headaches, and kind of what feels a little bit like flu-type symptoms. It's not the flu. It cannot cause complications or death or any kind of long-term issues. It can be uncomfortable, but it's treatable with medicines like Tylenol. So, we're talking about this because I think it's incredibly important to be transparent and to be completely honest about what you can expect with these vaccines. They are safe, they are effective. You can have some side effects. My experience, and remember that healthcare workers got this first so that we can make sure we could keep the hospitals open no matter what happened with this pandemic. And the vast majority of people didn't miss a single day of work when they got this vaccine. So there can be side effects with it, but I will tell you, as an ER doctor who treats COVID patients, COVID is worse than any side effect you're going to have from this vaccine. So the next question I had was, how is safety being monitored? Is it just the drug companies that are tracking it for themselves, or is there actually oversight here? And the good news is that this is being tracked at multiple levels. Your local health department, so So the local health department that's actually distributing this vaccine is keeping track of this. It's being tracked at the state level. And then at the federal level, there is what's called VAERS, or the Vaccine Adverse Event Reporting System, which is something that's been in place for all vaccines for a very long time. But it is being used for this as well. And so every single vaccine reaction that's reported is being reported at the local, state, and federal level. And true reactions are rare enough that they're really investigating basically each one of them. And we're getting a lot of data from that. But having learned all of this that I just talked to you about, again, being an ER doctor myself who's seen firsthand the tragic outcomes that have been wrought by this disease, I personally did not hesitate to get this vaccine once it became available to me. I've personally recommended it to every friend and family member that's eligible. My parents, my in-laws vaccinated, and I like all of them. As Dr. Zaidi showed, there's no corners cut in making this vaccine, and getting vaccinated is really the single best thing we can do to protect ourselves and our family and our community. So to that point, if the question next is who should be prioritized for getting the vaccine? Because as you may have seen, the rollout has been such that there's not immediate availability for everybody who might want one. And so the state has prioritized frontline workers who are needed to kind of, like I mentioned before, keep the hospitals open, police officers to be able to respond, and things like that, firefighters. But in terms of once they've gotten past that stage, we're talking about people who are at highest risk if they get COVID, and how do we protect them? How do we make sure that people that if they end up with COVID could end up in the hospital or on a ventilator or even dying from this disease? And so the folks that are being prioritized for this are, first off, those who are older, so age 75 and above, and then age 65 and above. What we've seen is that they are at the very highest risk of death from this illness and of having long-term complications from it. But also people with chronic medical conditions. People with cancer, people with chronic kidney disease, especially those who are on dialysis, people with COPD, which is a lung disease that can affect a number of people, but particularly smokers, long-term smokers, anyone with heart conditions, those with obesity, especially severe obesity, which is a BMI or body mass index over 40, particularly relevant to the Black and African American community, sickle cell disease, and then finally type 2 diabetes. And again, whether because of or if accentuated by historic and present disparities, these conditions are very prevalent among the Black and African American community. And because these conditions put you or your family member at higher risk, it's essential, especially for people with these conditions, and especially for our elderly population, to seek out and get this vaccine and protect themselves in that way. So thank you. That concludes what I wanted to speak about to you this evening. I'd be happy to answer any questions. I'll send it back to you, Karen.
Thank you so much, Dr. D'Souza. We're going to transition now to Dr. Anastasia Williams, one of our favorite pediatricians in the area, to speak to her experience. Thank you, Dr. Williams.
Thank you. Can you all hear me okay?
Yes,
Excellent.
we can.
I am recording here from the Girani Coffee House. Shout out to them, one of our small businesses in Old Town Manassas, and they're always ready to be in the midst of it, in the mix when it comes to community issues such as this, community health. This town hall meeting is very important to me, and I'm just going to take a few minutes to speak from the heart. I deliberately did not prepare anything in advance. I wanted to be organic. I did talk to a few people in my life as an African-American woman about the fears around getting vaccinated. As Karen mentioned, I am a pediatrician and I take what I do very seriously. I love all of my babies and my children. They're all my kids. And one of the biggest parts of my job is giving vaccines. That's 30% of what I do every day is give vaccines. And yes, I'm a scientist, but I'm also a mom. And I know that when parents come to me and I'm vaccinating their child, they are trusting me. They're trusting me that their child really needs it. The benefits outweigh the risks, that it's being done in a way that keeps them healthy. And that's my expectation as well for when I'm vaccinated or my family is vaccinated. I was very skeptical. I know Dr. D'Souza had no doubts whatsoever, and Dr. Zaidi did a wonderful job about talking about vaccine formation, but I had doubts. I think for me, when a new vaccine comes out, I don't rush to give all of my patients that vaccine until I am absolutely convinced that it is safe. And then when I tell them eye to eye, heart to heart, you should get vaccinated, that I feel good about the recommendation that I'm making. So I'm not one to just jump on the bandwagon because everybody says jump on the bandwagon. I honestly felt that there was so much botched with the management of the pandemic, that even me, myself, as a healthcare professional, I really didn't have a lot of trust. When it feels like people are speaking out of both sides of their mouth, don't wear a mask, you don't need a mask, oh, you should wear a mask, oh, the only reason we said that was because there were not enough masks. It's hard to roll it back and tell that same population, but trust me, you do need the vaccine. I have to say, in talking to my colleagues, to my family members, a lot of people are still right there. Is it a race issue? It's not a race issue because the hesitations that many of us have about vaccinating in general, and then specifically about the COVID vaccine, especially when you talk about this millennial generation, they're not really around race. They're around trust and believing that people are more about your health than about, I sound like I'm talking people out of getting the vaccine, but I'm not, I'm getting there, about business and industry and pharmaceuticals. These are the things that were going through my mind. And I dare say these are things that are going through a lot of people's minds. So for me, initially, I thought I would just sit back and wait and let everybody else get vaccinated. And after 6 months to a year, if their arm doesn't fall off, they can still talk and walk, they're still alive, perhaps I'd get the vaccine. Because I felt like the real trial, even though I know they said they did it safely and yada, 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 the real trial is when millions of people get the vaccine. But as we moved along with the pandemic, the facts really made themselves clear that, number one, coronavirus doesn't care if you plan to get vaccinated or not, if you're black or white. Coronavirus doesn't care about whether you're taking vitamin C and garlic juice and all the other things that a lot of people in our communities, and many communities, it's not just the Black community, take to stay healthy. Coronavirus doesn't care if you work out every single day. At the end of the day, it was killing everybody. When I say everybody, we know that most people don't die from coronavirus, but there's no way to tell who. And it was particularly real for me because my family, the majority of my family is in the New York City area. My son, his wife are there, and they're physicians, and they were in the thick of it when it was looking terrible. I mean, people were being put on ventilators left and right. They were taking care of really sick people. And honestly, it was really scary. And like Dr. D'Souza said, coronavirus kills people. The vaccine does not kill people. The vaccine saves lives. So for me, when I weigh the risk versus the benefits of getting the vaccine, especially the fact that I'm an outgoing person, I love socializing with people. I know the safest thing for us, and it still is, for us to do social distancing and put your mask on. But man, do I love giving my patients hugs. And there's something about when the kids are running up to you, Dr. Williams, and they give you a big hug and everything. And in the back of your mind, you're like, oh, shoot, she hugged me. I hope I don't get coronavirus. I'm going to give my family coronavirus. Oh, shoot. You give them a big hug, then you leave the room and you strip everything down and clean yourself off. it was just getting ridiculous. And the idea that there's this vaccine that is 95% effective, not necessarily from keeping me just from getting the disease, but that I won't get very sick. It decreases the likelihood that I'll take it to my, to my families, and it would allow me to live my life. So it's safe. So I made the decision. I jumped in, I held my breath, and I got the shot. There's some questions on there about shellfish allergy. I shouldn't tell y'all this because I don't want anybody to try to kill me, but I have shellfish allergies, peanut allergies. I have a lot of significant allergies. And I also was concerned about that. I know we're all watching the media, and there were cases of people who had severe allergic reaction. And the guys, you guys can probably speak more to this, but from what I understand, most of those people did not even have known serious allergies. But I had serious allergies. So when I went in there for my first coronavirus test, my heart was beating fast, but I had my EpiPen in my hand just in case I needed it. But I was really comforted that the people there, at least at our organization that were giving the vaccine, they had the emergency carts right there and they were ready on hand if there was any reaction. I did not have a reaction, not a serious reaction. And most of the people I know who have significant allergies did not have a reaction. Of course, one of the contraindications or one of the cautions for getting it is that if you haven't had a serious reaction to the first, allergic reaction to the first vaccine, because you have to have 2 shots, or if you have had a serious reaction to some other injectable vaccine, that you should be beware with getting the vaccine. So I got my first vaccine, the Pfizer shot. It went well, and I decided to share it with my colleagues and friends because I know that they're all pretty much thinking similarly. The second vaccine for me went smoothly. After the first vaccine, I felt kind of out of it, tired, kind of like I was coming down with something, that I lost my mojo, and that lasted for a couple of days. And then after that, I was fine. The second vaccine, I had some nausea for 3 or 4 days, and then I was fine. And it was nothing serious. Both times I had a pretty sore arm. That's the worst of it, but I'm just as bad as my little babies when it comes to shots and things like that, I must confess. But for me, before I got on this town hall, I called my sister, who I respect very much and is in the medical field as well. And she's very hesitant about getting the vaccine, as is all her family. And some of them have had COVID. And I just wanted to better understand, what is it? Because what is it that's causing us hesitation? Because I'll be honest with you, when those big vaccination drives happen and almost like it feels like 90% of the faces that I see getting vaccinated are Caucasian faces, are non-people of color. It breaks my heart to think that as time goes on, that you're going to have a whole segment of population that happens to be more vulnerable to the vaccine and serious morbidity, because like Dr. Zaidi said, we fall into a lot of those high-risk categories not getting vaccinated. How can we change that? And I'll end by saying her basic thing was, I don't trust. I don't feel like the system, whatever that is, I'm just putting it out there because I want to be honest, and I don't want people to think that we're just marching out here to do our duty to tell everybody to get vaccinated. We take your concerns very seriously. And every now and then, it's been probably almost a month now since I got my second vaccine, but if I get a strange cramp in my thumb, I'm like, oh, was it the vaccine? Of course it wasn't the vaccine. We just have to be very careful when we make decisions for ourselves and our families about whether or not to get vaccinated and whether or not to be safe even, because you can't go by the experience of one person or one story. You really got to look at the big picture. You hear us talking about research and data. You got to look at all the data. But I'll finish by saying my sister was basically like, I just do not trust that all of the information that's being put out there is pure and it's true. So my challenge to all of us is to try to figure out, and that's why I'm here to learn and to listen also, how do I reach those people who have decided they'd rather take their chances and, from my perspective, get corona and die than to take a vaccine and have a side effect. But thank you. I'm happy to answer any questions, and I look forward to learning more from all of you.
Thank you, Dr. Williams. I will take your organic conversation any day, or keeping it 100, as they say. With that, I would like to turn it over to Michelle Strider, who's going to share some information for us locally around the vaccine and where to go and how to sign up for it.
Sure, absolutely. Thank you, Karen, and good evening, everyone. I'm going to keep my piece nice and short because I know we want to have time to answer all of your questions and to be able to respond to anything you have for us. So, one thing we've been very fortunate about across our health system is our strong relationships with our local health departments, both in Prince William County and in the Rappahannock-Rapidan area where we also serve. So we have maintained our partnership with them and are partnering with them for both our allocation of vaccines and for guidance on where to direct those vaccinations. Right now in Virginia, as Dr. D'Souza mentioned, we do still fall under the state guidance of sticking to the categories of 1A and 1B as specified by the state. He covered kind of who fits in that criteria, so I'm going to skip that section. But it's pretty well defined and pretty laid out who we can target for vaccination at this time. Just this week, the state of Virginia combined all of their local health department waiting lists into one statewide system that can be broken down by county. So those who are seeking vaccination can join that list, that statewide list, by going to vaccinate.virginia.gov or calling 877-275-8343 between the hours of 8 a.m. and 8 p.m. I think moving to the statewide module that is still broken down by county will help to ease some of that pain that we've been experiencing by each county having their individual wait lists. We continue in Novant Health UVA Health System to advocate for vaccines for our communities, and we continue to offer ourselves in partnership in the increasing vaccine rates for our populations. And we are committed to ensuring that we promote health equity related to vaccinations. And that's really the push that we have in partnering with the local health departments, is that we push for health equity in our communities. And that's something we're committed to continuing to do. So that's all I have. I'm going to turn it back to you, Karen. And again, happy to answer questions related to vaccine allocation or access.
Thanks, Michelle. We're going to ask Dr. Stephen Smith to jump in here and round out our conversation. Thank you.
Good evening. Through this pandemic, I think all of us have tried to use different tools to maintain our mental resilience because it's been a challenging time. And one tool that I've been really focused on is gratitude. And I'm grateful for the opportunity to be able to have this conversation because it's incredibly important. What we suffer from, in as much as that we're having this discussion, is there's a trust deficit. There's a gap there. And with communities of color, there's a historical perspective behind it. There is history there. This is just not like, I'm scared to get the vaccine. There's a reason that there's fear. This is generational fear. I was having a lunch with Dr. Zaidi, and we were talking about this evening, and we were both very excited about it. And he says, there's so much fear. And we talked about how this one guy, J. Marion Sims, who's actually the father of American gynecology, modern gynecology or women's health, the things he did to enslave people to master these techniques were so unethical. Or people have heard potentially of John Charles Cutter. You might know him from the Tuskegee experiment, and where needless trauma was allowed to occur to people with syphilis when there was a treatment for it. Oh, and Dr. Cutter, he did the same thing in Guatemala. So people in Central and South America actually had the same misfortune. So that historical perspective of trust, it's not an irrational fear that we have. It's from our history that we enter this whole situation with a certain cynicism. I've had the good fortune of having trained at Howard University, and I trained in South Central Los Angeles in populations that had, we called it disparities of healthcare. And there are a couple of things that cause disparities in healthcare. Some are education and resources, but there's also the mindset of the community of this trust. Because if you don't have access to something, that's one problem for your health. But if you have access to something but are unwilling to take it, that creates a problem as well. So I'll tell you, if I had known that Dr. Williams felt like she had lost her mojo, I might have had greater reservations to taking it. But to put things really in perspective, there's a calculus we all have to make. There's a lot of information that has been shoveled out, and there's been a lot of work done. And the reality is that there's possibilities and probabilities. Okay, there's a possibility I could get hit by lightning right now. I probably won't though. So all the possibilities about the vaccine, those are all true, but they're all unlikely. It has been shown to be safe and efficient. And yes, you might have some soreness in your arm, you might have some flu-like symptoms. But I'll tell you one thing, I've walked the intensive care unit at our hospital. And that is a real possibility that is far greater of a probability than any of those consequences you could get with the vaccine. Everyone has to make their own calculus. For me, the opportunity to be able to protect my family and to be able to make sure that I remain healthy so that I could serve made me willingly look forward to having that vaccine. The other thing is, in this calculus, is what really are your options? If you don't get it, that's fine, but you leave yourself susceptible to something that you easily, potentially could have prevented. We all know what the consequences of not getting the vaccine are. And people will say, well, we don't know about all the possible side effects of the vaccine. Well, we don't know about all the possible side effects of the virus in the long run. If I had told you you got chickenpox and maybe 30 years later you get shingles, who would have figured? We don't know. So I just think that it's important that we try and close this trust deficit that exists between communities of color and the institutions of medicine. And I appreciate Reverend Bailey for helping us close that trust deficit by having and supporting this conversation.
Thank you, Dr. Smith. And I'd like to thank all of our panelists for sharing great information and great facts and your experience. I see that we have answered quite a few questions that we did receive in advance. There is one question that I would like to start off with, and I'm going to ask that of Reverend Bailey. And the question is, my aging parents don't want to get the vaccine because they believe that God will protect them. How do I respect their beliefs, but also advocate for them to get the vaccine? A great question, because I have this also in my Black and African American family. So thank you, Reverend Bailey.
Thank you, Karen, for the question. Okay, so my first answer to that, and I have multiple answers to it, okay, is, and I mean this with all sincerity, their aging parents are absolutely right. God can and God will protect them. But one of the joys in my life is experiencing how God protects. There are a couple of scriptures that come to mind, but one of them is from the 7th chapter of Deuteronomy, chapter 15, where it says, the Lord will take away all your sicknesses and will afflict you with none of the terrible diseases. So right there, God promises to protect us. In that particular instance, he was talking about the children of Israel as they were leaving bondage in Egypt and moving to their promised land. And so the question is how will God then do that? And another scripture comes to mind is Romans 10:14, and what it ends with, how can they hear without a preacher? What God is telling the people through Paul there is that he uses people to do certain things. The reason that I can walk today is at the age of 17, after suffering an almost total separation of my medial collateral ligament, is that God sent me one of the greatest orthopedic surgeons that was in the East Coast at that time. And so God protected me by using someone that God had empowered and prepared to do his will. But even as I say that, those people should respect, again, their aging parents' wishes. If they are a member of an organized community of faith, I would partner with the leader of that community and ask him to speak with them. There are a variety of things that are at work there. And so, again, several layers of answers to that. And I hope that I've helped them with that answer.
Thank you, Reverend Bailey. That was great. We have another question, is should women that are breastfeeding get the vaccine? I'm wondering if Dr. Zeta, you would like to take that one.
I'd be happy to. And questions around pregnant women and postpartum women are really important, because when phase 3 clinical trials are done, pregnant women are often not willing to enroll in those and often not eligible to enroll for those. And so we can't say for sure that it was studied, but experts in that field have been recommending all along that it is safe to do so, and that the benefit is better than the risk. We have certainly seen in pregnant women that pregnant women with COVID do worse than women the same age who are not pregnant who get COVID, and so that's what we've been recommending. Thanks for the question.
Thank you. We have another question that's here that is, how often will we need to get the vaccine after we've had the 2 doses administered? Will it be like the flu vaccine that we have to get it yearly? Great question.
Yeah, I'm happy to take that one too. That is a really good question, and the answer is we don't know. To answer this today, I would say I don't think it's likely that this will be annual. We have, when we look at worldwide infection rates and reinfection rates, they're so astronomically low that, remember, we're only 1 year into this, so we only really know what happens to that point. And when we talk about vaccines and where those trials sit, we're about 9 months into it. But we know a lot about respiratory viruses in general. And we know a lot about how the immune system works in general. And so I think that it's, this is just my opinion. I think it will likely be several years. It's probably more likely that there may be a need to get a booster at some point if these variants that we're talking about become something a lot uglier in a couple of years. And this is a good use of this technology, that is out there now, is that, they can update these vaccines in less than 48 hours. And then it would just be a matter of repeating some of the safety and trial data again. But I thought it was really interesting. A few years ago, they tested the blood of some survivors from the last pandemic, so the 1918 Spanish flu. And what they found in these patients 90 years later was that their immune system was still making antibodies against that challenge, and that says a lot. And so, I'm hopeful. If we have to do it, we'll do it, but I don't think it's likely.
Thank you. We have another question, and I realize that we are at our time, but I want to make sure we do answer this question. It's a long one. So it has been reported that for the second dose, after the initial 21 or 28 days, depending on the specific vaccine, there is still time to get a second dose up to or after 42 days or 6 weeks. Is that true?
So I will say that we have a recommended guideline for when you should get the second dose, which is what you just stated in your question. But the honest truth is that if you miss that timeline, we still recommend that you get that second dose whenever you can get it. We know that things are going to happen with employment and travel and life circumstances where it may not fall within that 42-day window. But you do not have to start over the way that Anastasia will maybe sometimes have to tell her patients in the clinic or otherwise. You do not have to start over. If you happen to get that second dose and it's 60 or 70 days out, you will still be protected. I'm certain of that. It's just not what we recommend for the population at large.
Excellent, thank you. And we also have, just to re-clarify, and we did hear Dr. Souza speak about this earlier, but just to clarify, is it safe for people that have sickle cell to take the vaccine?
It absolutely is. And in fact, it's particularly recommended for people who have sickle cell disease. The vaccine is not believed to have, has not been shown in any way to have any additional side effects or complications or anything like that for people with sickle cell disease. However, COVID has been shown to be particularly dangerous and even deadly for people with sickle cell disease. So I strongly encourage all those with that condition to become vaccinated.
Wonderful. Thank you, Dr. D'Souza. So as we get ready to conclude, I'm going to turn over to Reverend Bailey to share his closing perspectives.
Again, thank you, Karen. I got to tell you, this has been an exhilarating evening for me, and I hope that it's been helpful to all who have been listening. Again, what the intent was to provide facts from trusted sources, from knowledgeable sources, to answer questions as they were brought up. And as I've gotten to know this group of people, I will tell you that I trust them totally. They are very knowledgeable, they're very great, and they do what they do, obviously because of the love of medicine, but in order to serve the community as well. So after tonight, I hope that everyone now has a better set of standards and facts to make that decision on whether or not to receive this vaccine when it becomes available. I will tell you that after listening to these folks and doing my own research, I have begun my regimen. I have my first shot of Moderna. In a week and a half, I'll have my second one because I believe it's necessary and required. And I just ask that all of you who have been listening and talk to the friends of yours and acquaintances who have not been able to listen tonight to make that same decision. It is so important that we in this community of Prince William and the associated communities that Novant UVA serves, and across this country and yea, across this world, begin to use what God has given us to bring ourselves out of this worldwide pandemic and really then enjoy and discover what our new normal will be. Thank you all so much, and I appreciate all of the crew from Novant UVA. Karen, back to you.
Thanks, Reverend Bailey. I'm actually going to turn it to our Community Engagement Director, Kim Galansky.
Good evening, Kim Galansky, Director of Community Engagement with Novant Health UVA Health System. I'd like to take a moment to recognize our community partners for sharing their passion, their expertise, and their time to support tonight's education and conversation. And I would like to personally thank Reverend Bailey for his tireless advocacy and action on behalf of the community. Reverend Bailey, you, sir, are a true healthcare hero. Last summer when we were out in that 90-degree heat to provide COVID-19 testing, you shared your voice with me and you said, Kim, there's more work to be done. And I don't know if you remember, but you asked and you said, how long is Novant Health UVA willing to continue to work together? And our answer continues to be, we are committed. We are committed to our communities, and we are committed to working together alongside each other. I'd also like to personally thank Ken Mormon, owner of Durrani Coffee House, where Dr. Williams is currently sitting. So I like to practice listening to understand. And we received a recommendation from Dr. Hinton Jackson, who's one of our board members in our Culpeper service area. And she had a recommendation about safely hosting a watch party, and specifically in order to remove technology barriers that may exist within our communities. So after listening to Dr. Hinton Jackson, I knew exactly who to call here in the Greater Prince William area, in the Greater Prince William community. And that was our friends at Durrani. Durrani is more than coffee. It's community and it's love. So Ken and Durrani Coffee House, thank you for being a willing partner and for being so nimble to support this important conversation. Again, to all of our partners, just want to say thank you for your partnership. And I believe, as shown again this evening, community is the solution. Back to you, Karin. Thanks.
Thank you, Kim. This has been an amazing evening. We really appreciate your time that you spent with us, your questions, your vulnerability, you listening, and right back us listening to you. We will be sending out the information that we shared previously with how to connect with us and get continuing information on the vaccine, as well as to sign up for the vaccine if that's something that you're choosing to do. At Novant Health UVA Health System, we are continuing to build bridges of trust in our community. We are continuing to listen to understand our community, specifically our communities of color, our Black and African American communities, our Hispanic, Latino communities. Diversity, inclusion, and equity is part of our values. So thank you for being with us tonight. Thank you for sharing your time. We wish you a safe and great evening, and we hope that this has been the beginning of many conversations to come. Thank you and good night.